I want to talk for a few minutes about what's happening with health care. I came to the floor last week to talk about individuals that were having problems, and people are contacting our office. In fact, I suspect they're contacting 100 Senate offices every day, expressing their concerns as they lose insurance. 4.2 million Americans have now received cancellation notices on the insurance they had. I noticed last week when the president made his proposal that apparently you could keep the insurance you like for a year if your insurance company will still offer it and if the state insurance commissioner will approve it. Those are two pretty big ifs, and certainly are nowhere close to you can keep your insurance if you like it, period. If you like your doctor, you can keep your doctor, period. Neither of those are going to turn out to be the case. And in fact, insurance commissioners immediately, their organization said, this is going to be practically very, very hard to comply with. So that's just one of many problems. I think the law here that is most likely to apply with the Affordable Care Act will be the law of unintended consequences. Consequences for individuals, consequences for people who had pre-existing conditions, who in 35 states were being well served by something called the high-risk pool. All of those people, I think virtually all of those high-risk pools, go out of existence on December 31. I know the Missouri high-risk pool goes out of existence on December 31, and the 4,300 people who depended on that for their insurance now have to find insurance on their own. Now they can get insurance, they can get it through the exchange. In all cases I've heard so far, they're paying more for insurance on January 1 than they were paying for coverage on today or would pay up through the end of this year. So much for what we're doing for people with pre-existing conditions. There was certainly a way to extend those high-risk pools. We didn't do that. This week I've had a number of businesses talk about the problems they're having. I want to talk about two of them briefly this morning. One of them is the Older Adults Transportation System in our state. It's headquartered near the middle of the state in Columbia, Missouri. It provides transportation for seniors, for people who are disabled, for low-income Missourians. Like many, the Older Adults Transportation System, called OATS, was notified that their current plan will be canceled on January 1. The rate for their new policy for their 50 full-time employees is going to be 40% higher on January 1 than the policy that they had on December 31. And the only way they can do anything about that is to provide fewer services. So because of that 40% increase, fewer trips will be available to take the people they serve. Surely that wasn't the goal of the health care plan. They wanted to insure their driving staff. There are 600 drivers in that system. They wanted to insure them. They were actually hopeful that with all the promises about the Affordable Care Act, that they'd be able to add their driving staff. But instead of adding their driving staff, they've got to figure out what they're going to do with the 50 employees they've been insuring at rates that are now 40% higher than they were before. Businesses around the state are calling. I recently heard from McArthur's Bakery in St. Louis. They currently had a cap, a 9% cap on a 2-year health policy that they had. It was a qualified plan. But Randy, the president of McArthur's Bakery, Randy McArthur, believes that they had a pretty good plan. He thought their plan was a plan that should meet any standard that they would hope to meet. It wasn't a rich plan. He described it to me as not a Cadillac plan, but at least an Impala plan. And they thought the Impala was what they could do. But suddenly they've learned that there's going to be a 4.4% increase in fees and taxes and a huge increase in the deductible. Their current plan has a deductible of around $500 for an individual and $1,250 for a family. The deductible on the new plan is going to be about $3,500 for the individual and $10,000 to $12,000 for the family. You know, Madam President, that's what I'm hearing all the time, that the coverage may be broader. There may be things covered that didn't used to be covered, but the deductible is now so big that the plan that people had that they thought protected their needs don't protect their needs. You know, for most families, $12,000 is catastrophic. It doesn't take $120,000 or $500,000 to be catastrophic. $12,000 is catastrophic, and if that becomes your new deductible year after year, you've got a problem that you didn't have when your deductible was $1,200. Randy McArthur says the very thing that Obamacare was supposed to do was to protect the working people, to give them access to affordable insurance, but is actually doing the exact opposite. Instead, the law will mandate coverage, things that you have to pay for that you didn't have to pay for before, and apparently will offset that by being sure that you pay a lot more of your own money up front. I think we're going to continue to see these problems develop. I hope we can find ways to fix that. I introduced a number of bills in 2009 that I thought were better alternatives than this one. We may have to go back and start all over again. But right now, the one thing we do know is that the law of unintended consequences appears to be hitting a lot of families and hitting a lot of families very hard.